Hello, everybody. Dr. Herbert Weissman here with your monthly update as to how we're doing post-COVID. We've been open now for 9 weeks, and I have to say I'm really grateful to all of you out there who've come out and have continued to take care of your oral health. I know many of you initially were very apprehensive, and that's perfectly understandable given the circumstances. However, I've also explained to everyone that we've done everything in our power to ensure that you are safe. So if you have any concerns at any time, please feel free to give us a call and we'll be more than happy to answer all of your questions. But rest assured that we've had many very nervous patients, very anxious about what might happen to them as a result of coming in, and everyone's done really well. Just for your information, there have been no reported cases of coronavirus, COVID-19, from any other offices anywhere in the world at this point. Certainly nothing confirmed that I know about, and just want to make sure that you feel safe. So any questions, any concerns, feel free to give us a call. We very much look forward to seeing you back. One of the things that I want to explain is the importance of oral health and how it relates to coronavirus and COVID-19. There is a very strong link between periodontal disease and release of what we call inflammatory mediators. First of all, the bacteria that cause gum disease can be aspirated or breathed in normally, and that can, in combination, if you should contract the virus, could contribute to what's called a superinfection. And those who die from coronavirus die from superinfections in the most part. They die from pneumonia, acute respiratory distress syndrome, renal failure, cardiovascular failure. But the pneumonia and the acute respiratory distress syndrome are caused by bacteria. So what happens is the virus makes it easier for these bacteria, oral bacteria, to attach to the epithelium lining of the respiratory tract. Therefore, more of a chance for a superinfection. So how do we know that inflammation, which is a huge problem in general, inflammation causes cancer, inflammation causes diabetes, inflammation causes all sorts of illnesses. So the inflammatory state is a very dangerous situation in the human body, especially one that is chronic and long-lasting. How do we know that inflammation and bacterial infections, superinfections, are what ultimately do people in with regards to the coronavirus? Well, let's look at the medications that are used to treat this. So we've known of a couple at least, antivirals like remdesivir and hydroxychloroquine. We also know of azithromycin. And we also know of anti-inflammatory medications have been approved in countries like Japan, for example, like dexamethasone, corticosteroids, okay? These corticosteroids decrease inflammation, and they've been shown to be very effective in people who were very far along with COVID-19 and needed respiratory help, such as ventilators, okay? So use of anti-inflammatories has been huge and effective. Therefore, we are treating an inflammatory response. Also, medications like azithromycin, which fight off potential for all kinds of respiratory ailments like pneumonia, preventatively, okay, are very effective. In certain studies that have been done where they had controls, then they just gave a hydroxychloroquine and they gave hydroxychloroquine with azithromycin. They've noted that those who just took hydroxychloroquine had about 50% effective recovery, whereas those who took hydroxychloroquine and azithromycin had basically 100% recovery. So we know it's a bacterial infection. And where do we find a lot of bacteria? The mouth. So keeping oral health and good periodontal health is the answer. If you have any other questions, feel free to give me a call. I look forward to seeing you soon. God bless.